program designed to alleviate Vermont's nursing shortage, taking a toll on regulators' budget.
Vermont's Interstate Nursing Licensure Compact allows nurses and LPNs to practice across state lines with the aim of bolstering the workforce.
The pandemic caused a mass exodus of nurses, and staffing was down even before that. To make up for the loss, places like the University of Vermont Health Network budgeted $350 million for traveling staff in the past 3 years. That's double the amount that it cost them to pay for permanent nurses.
But a new report shows it's draining the budget of the Office of Professional Regulation. Channel 3's Calvin Cutler is live in our Montpelier Bureau. Calvin, what do you know about this?
Yeah, Darren and Kat, good evening. The soaring price of healthcare is continuing to take a toll on many parts of the state, from the state budget to local property taxes and school spending. Now, the law designed to help with the nursing shortage and allow for more opportunities for more people to practice here in Vermont is also costing the state millions. Staff shortages are forcing hospitals to hire expensive traveling nurses.
Our workforce crisis is probably the biggest threat facing our healthcare system.
Under a law passed 2 years ago, Vermont began offering multi-state licenses for registered nurses and licensed practical nurses to make it easier to practice across state lines. Vermont now has over 3,200 nurses licensed in multiple states and over 6,500 nurses licensed only in Vermont. The state does not track where they're practicing, but administering the program has come at a toll. Nurses from other states who have multi-state licenses are not paying for Vermont licenses.
We knew that this was going to cause a loss of revenue for the Office of Professional Regulation.
For a fee, the state administers certificates and licenses for dozens of professions, from nursing to architects to real estate brokers. The Office of Professional Regulation's annual budget is $6.6 million. Administering the nursing compact will cost them $1.2 million every 2 years.
Licensing revenue not only covers the cost of issuing the license and renewing the license, but it also covers the cost of enforcement.
She says they've already raised fees, and those only fall on Vermont nurses. Meanwhile, lawmakers are considering other interstate compacts for occupational therapy, mental health, and more. Multiple states are adopting interstate licenses. But Hibbert says lawmakers need to come up with a new funding model for OPR. Officials agree that the compact is an important tool in recruiting, but it's not clear on how many people it's bringing in.
This is a strategy that helps it make it easier for us to recruit nurses. It's as simple as that.
Jill Maza-Olson with the Visiting Nurses Association adds that investments like paying for loan forgiveness and workforce training are big pieces of the puzzle.
It's going to always be hard for us to identify which of our strategies is creating change, but we need all of the strategies because the problem is so significant.
Now, the examination of the licensure program follows a recent review from Vermont State Auditor Doug Hoffer, who is looking into nursing workforce programs and whether they were paying off. For now, reporting live in our Montpelier Bureau, Calvin Cutler, Channel 3 News.
Calvin, thank you.